Hi there, this is Dr. Funke Brown. I hope you're well. So, several months ago, I got a call from a friend who said her son needed to be admitted in the hospital after he urgently needed removal of his adenoids and his tonsils. And what had happened was, let's call him David, a 2 year old toddler, had had some snoring for a few months, but this had coincided with when he started daycare. And so really seemed like he was congested, and so that congestion just seemed worse at night and was contributing to the snoring. So this didn't really alarm the parents because they felt, okay, he has a cold. Once he's recovered, he'll stop. But then even outside of colds, he was having this snoring. The reason why I bring that up is because sometimes, especially when children are in daycare, they may get colds here and there, so really not much to worry about. And if people are congested, they may snore. So again, not necessarily something alarming. The other piece though with David was, in addition to the snoring, he was also waking up relatively frequently at night, but would put himself back to sleep. So again, not necessarily something alarming. The only piece though was, mom was told he had a little bit of delay in his speech and just a little lag behind in his development. So things really came to head when he went for his routine checkup at the pediatrician's office. And when he was there, he fell asleep and they noticed he was snoring. And they noticed the snoring was a bit loud, persistent. It seemed like he was having brief pauses. And so he did seem a little bit pale, and they had checked his oxygen level. And when they checked that, it seemed a little low. And so based on that, the pediatrician was concerned. Actually, it wasn't just a little bit low. It was somewhere in the high 80s. Typically, your oxygen concentration should be above 95%. So based on that, there was concern with his symptoms, and he was sent to the emergency room where he was evaluated by the ear, nose, and throat doctors. And upon seeing him, hearing the story, and also seeing him snore and have these pauses right in front of them, they felt there was concern he had severe obstructive sleep apnea. He was taken to the OR where he had the procedure to take out his tonsils and adenoids, which we call adenotonsillectomy. He was monitored in the hospital for a couple of days afterwards, got better, and then was sent home really healthy. The interesting thing was, after surgery, within a few weeks, first his snoring got significantly better. He was able to sleep more restfully through the night. And also, his speech and his development seemed to catch up all of a sudden. The other piece that mom noticed was also, even though he's a toddler and rambunctious and full of energy, he just seemed to be less cranky overall. And I share that story because this is not something that's uncommon. Many children have sleep apnea that gets diagnosed, and once they get treated, they're better. A little unique with David is most of them, though, end up not needing to go to the emergency room, thankfully. And this experience was also part of why I was motivated to create Restful Sleep MD, where I hope to help parents to learn how to prioritize sleeping their children and to advocate for their child's sleep health and wellness. Because when children sleep well, then the parents sleep well as well. So when I think about restful sleep, there are three things that I consider. The first is the sleep quantity. And this is the number of hours of sleep you get at night. You may have heard that, I'm sure, where infants and young children get a specific number of hours, and that need decreases with age. So for instance, in the newborn period, a child may be sleeping 14 to 17 hours a day. And then in teenagers, where it's about 8 to 10 hours of sleep. and in adulthood, about 7 to 9 hours of sleep is required. Now, the National Sleep Foundation actually has these recommendations based by age, and I'm going to include that in the show notes for your review. Again, this is sleep quantity. If you get adequate sleep quantity, it helps your sleep. But that's not the only thing. The second thing I consider when we're talking about restful sleep is what you call the sleep quality. When we talk about the quality of sleep, if it's affected, you're not really able to get good, refreshing sleep. And things that can affect the quality of our sleep tend to be sort of habits that we get into, or that if we don't practice good sleep habits. So, for example, if you drink caffeine or caffeinated beverages about bedtime, that can affect the quality of your sleep. And things like electronics in bed, or falling asleep on devices, or waking up in the middle of the night briefly and then getting onto the devices and the iPhone and things like that, this can affect sleep quality. Other things are, medical conditions like asthma or sleep apnea, where sleep gets fragmented, and so the quality of your sleep can be affected as well. Then the third thing is sleep continuity. And so we essentially go through different stages of sleep. You have what you call non-REM sleep and REM sleep. And in non-REM sleep, it's broken down into 3 further stages. So stage 1, stage 2, and stage 3. To me, I think of very light sleep and then deep sleep. And during non-REM sleep, it's such a critical part of a child's development, of an adult's development as well. Because really that is when you get secretion of hormones like growth hormone, which is important for a child to grow. And also you get tissue restoration, rejuvenation, and boosting of your immune system. So non-REM sleep is really critical. And then the REM sleep is the rapid eye movement sleep, or the dream sleep, which is also very important for so many functions. We're still trying to understand the functions of sleep, but we can tell that a lot of benefits can be obtained. So if you have fragmented sleep, or you're not able to have continuous sleep, you're not really getting that deep sleep, and that can impact so many parts of life. Examples of things that can cause fragmented sleep are medical conditions like obstructive sleep apnea, for instance, like David, where you're snoring and you may have brief pauses, and then what happens is your brain kicks in to try to wake you up so that you can resume breathing. Or conditions like restless leg syndrome, where there's frequent kicks due to discomfort in the legs, and you just feel like you need to move your legs around a lot. So what that does is it also creates your brain to arouse frequently, and then that will fragment your sleep further. Other things like asthma or other medical conditions as well can cause sleep fragmentation if it's not well controlled. Or things like medications, for instance. For example, if you're on a blood pressure medicine and you need to use the bathroom and you're waking up frequently to use the bathroom, that can also affect your sleep continuity. So these are the things that impact restful sleep. And why do we feel that restful sleep is critical? I would say the benefits of sleep spans everything we do in life. So starting from our children and their growth, sleep, again, like I mentioned, is important for them to grow and develop, and also for memory and for learning. And there's studies that have shown that impaired sleep or insufficient sleep is associated with poor learning, poor memory, impacts academic performance. Additionally, if you don't get good quality sleep, there's risk of poor behaviors. And so children can have inattentiveness and behavioral problems when they don't sleep well. Then other things that we think about also that's related to sleep include medical physical problems, or physical problems like heart conditions, like increased risk of cardiovascular problems and hypertension. In adults, has been impaired sleep has been associated with increased risk of stroke as well. And also it's been linked to obesity as well as diabetes. And then the third thing that sleep affects is our mood. Our mood can be affected by sleep. And so you can tell that in a child who has not gotten good sleep. I'm sure you've had that experience where if your child had a rough night, they just seem to be just more cranky. If it's a teenager, they may be more moody. If there's a history of anxiety or depression, poor sleep actually makes this seem worse. And there's also associations with adverse consequences like poor decision making and increased risk of suicidality, which has been shown to occur even in our teenagers. So as we can see, all the way from just memory to our physical health to our mood, these things can be affected when we don't get restful sleep. So now we know that the sleep quantity, quality, and continuity is affected by sleep. And also we've seen that sleep is really important for our optimal health. All aspects of our health and development can be affected by sleep. What can we do to make sure that we get restful sleep? I will talk about 3 things. The first thing is to make sure you get the adequate number of hours of sleep. You can do this when you prioritize your sleep. Again, in the show notes, you'll see the recommended number of hours. But like I mentioned, in infants, they need more. Our toddlers need a different number of hours. And in teenagers as well, they need about 8 to 10 hours. And really, our children need sleep and we need sleep. So really prioritizing sleep and making sure we get the sufficient number of hours. The second thing we could do to focus on the quality of our sleep is to make sure we have healthy sleep habits. So some of those healthy sleep habits include things like maintaining a consistent bedtime and a consistent wake time. So waking up at the same time every morning and going to bed at the same time at night. We do this for a lot of our young children, but throughout life we do need that consistency. So our brain is not wondering, is it time to sleep or not? So our bodies we're creatures of habits, and so once you maintain that consistency, that goes through with you. The second thing is to have a bedtime routine, and whatever that is, it doesn't have to be complicated. A couple of relaxing activities that take you in the direction of the bedroom. Things like reading a book or taking a shower, reading a book and then going to bed. So you're really setting the mood for sleep. Other healthy sleep habits include things that will promote a good sleep environment. You want the room to be dark, to be quiet and free of noise, as well as to be cool. Because when you have a healthy sleep environment, you're able to fall asleep and stay asleep well. You know the tossing and turning you get when you sweat, when you're sleeping. Well, that's not necessarily good for sleep and can affect the quality of sleep you get. One other thing I should mention is caffeine, eliminating caffeine at bedtime. Caffeine stays in your system for a long time and really keeps you aroused, and so can affect your sleep quality as well. And then I had also mentioned the technology, the screen time, really staying away from that, because that emits this blue light that can trick our brain to thinking that it's still daytime. And when our brain thinks it's daytime, melatonin, which is the sleep hormone, doesn't get released. So those are 2 things. And then the third one that I think is really important. If you think your child has a sleep disorder, if you're starting to hear snoring or constant restlessness or anything that's worrisome at bedtime, it's important to bring it to the attention of your pediatrician and to discuss it, because they will help you navigate and decide if you need more testing or if you need to see a sleep specialist, and they will be able to help you with that. So, as we can see, we can get restful sleep if we focus on the quality, the quantity, as well as the continuity. So I would like you to like and subscribe to my channel, as well as share this content with anyone in your circles that you feel would benefit from it. You can also connect with me on Instagram at Restful Sleep MD, where I provide healthy, evidence-based, and practical tips to promote healthy sleep for the entire family. Because when we sleep well, when we focus on the things that matter, when we prioritize sleep, we and our children can be happier, healthier, and more successful. So I'll see you next time. And until then, I hope you get restful sleep.